Nice to see you, everyone. And today we're gonna have our next podcast. And today we're gonna have our dear guest, Cynthia Cardenas, our general dentist. And how are we gonna start? We're gonna start again. Why? Because everybody asking, like, our patients and our future patients, why people decide to be, because it's so many different opportunities to be, why decide to be a dentist?
Well, I decided to be a dentist. It was really a fluke thing. All my life I thought I wanted to be an airplane pilot.
Wow.
And I was very interested in going to the Air Force Academy to learn to be a pilot. And I continued that and I applied, and I was told that I could not be an airplane pilot for the Air Force because you have to have 20/20 vision. And I did not have 20/20 vision, so that kind of blew that out the water. And I was already in high school, so I was a little devastated because I was thinking, what am I gonna do with my life? I don't wanna go to college without knowing what I want to study and what I wanna be. And then just one day out of the blue, a friend of mine that I went to high school with, she called me and asked me if I would like a job as a dental assistant, that she was working at a dental office as a receptionist and the doctor needed a dental assistant. And I thought, why would they hire me? I know nothing about dentistry. And she's like, oh, don't worry, he's willing to train you and he's paying $5 an hour. And that was big time. This is 1988.
Wow.
So I went to work at this practice. I was hired. I started working chairside with the dentist, and I loved it. I really loved doing the dentistry with him, and I loved the fact that it was never monotonous. It was not doing the same thing over and over again, because even, as you know, if you're doing the same procedure, you're talking to new people.
Yeah.
And I think that was what was most appealing.
New patients.
Correct.
Every time, yeah.
Correct. So, after a few months, I decided this is what I wanted to do, and that was what I focused on.
And can I ask you, where did you grow up and where did you go to school?
I grew up in Michigan, in the Metro Detroit area, suburb of Detroit. And I went to dental school, undergrad and dental school at University of Detroit Mercy.
Nice, very nice, very nice. And after you finish the school, how you decide what you're gonna do? You're gonna open your practice, or you're gonna be associate? What did you do after you finished school?
So actually, when I was in my first year of dental school, very early on in the year, I learned about some health professional scholarships that both the Air Force and the Navy offered to dental students. And so I researched that, and I ended up applying and receiving a full scholarship from the United States Navy to finish dental school and then go work for the Navy as a dental officer.
That means right after finish school, it's where your residence was right in the Navy.
Correct.
Wow.
Literally, the day after I graduated dental school, I was on a flight to Newport, Rhode Island for 6 weeks of officer indoctrination school. So with the scholarship, it was a direct commission to a lieutenant in the Navy, and I did those 6 weeks of officer indoctrination school to learn how to be an officer in the Navy. After that, I was designated to my first duty station, which was here in Great Lakes. For 1 year, I was able to do an advanced education general dentistry residency program there, which counted towards one of the years that I owed the Navy back for the scholarship. So it was very great experience, great training.
But when you do the residency at the Great Lakes, like, it's everything was on the base, like doctors, labs, let's say the Navy guy is gonna come out right to you.
Correct.
And you did everything in place.
Everything on base.
And let's say after Great Lakes, what did you do after Great Lakes?
After Great Lakes, I was assigned to an aircraft carrier out of Mayport, Florida. So my second duty station was on the USS Kennedy.
What? It's a real one. Oh my God.
Yes, it's a real one. And I was assigned to that ship for 2 years.
Wow. How many sailors? I mean, how many total people on the ship?
So ship's company, there's 3,000 people, and whenever we went out to sea, the air wing comes in, and that's another 2,000. So
It's
we
5,000
5,000 personnel.
Wow.
So yeah, definitely a floating city.
And how you were busy? How, I mean, I don't know if everybody needs attention, like from dental attention, but you were busy or not busy?
I was very busy.
Really?
Yes. So I was on the ship from 2001 to 2003. Actually, my first day out to sea, about an hour after we left port, 9/11 occurred.
Oh, right, 2001.
Yeah. So that deterred our entire mission. We were out to sea for a lot longer than was projected for that underway. And the following January, we did deploy to the Persian Gulf for 6.5 months during Operation Enduring Freedom. And yes, I did dentistry 6 days a week, 12-hour days.
Oh my God.
Sunday was a light day. We only worked 8 hours on Sunday.
That means no day off.
No day off.
Wow.
Which honestly, when you're on a ship, you are happy to not have any days off because there's only so much you can do.
You can
I did have one time where we went out to sea for 2 weeks, and engineering department was working on LP air. LP air is what is used for the turbines and the handpieces. So for the 2-week underway, we couldn't do dentistry because that was being worked on, and it was very difficult because
it was nothing to
you
do.
can only watch so much TV, work out so much. You know, there's not much that you wanna work.
But mostly, I mean, I just curious because it's like a carrier ship. What kind of dentistry you can do on a ship? I mean, root canals, crowns, removal, fillings.
I definitely did root canal therapy, a lot of fillings, just regular recall. So in the Navy, the dental department, our mission is to have what they call 100% dental readiness. And what does that mean? That we have to make sure everybody is up to date with a dental exam because everyone needs to be in dental health to the point where if tomorrow you were notified that you're going to deploy, that there's not any potential dental issues that could occur to this person while they're possibly deployed somewhere where they don't have access to dental care. So that's a very important mission too. So we constantly, with 5,000 personnel, we were very busy.
Just come out. Is it like any sellers were kind of picky? No, I don't like this crown. No, it's different color. No? It just...
I mean, there was some. I can think of, maybe if it was an officer, I can think of a particular female officer that had a composite,
composite.
a composite on number 9 that, had to, was particular about the appearance and the aesthetics, and that's a good thing because, we want to perfect your skill. You don't want to just do sloppy work.
Yeah, but you're not in in a regular office with a regular lab when you can do let's say you can do what you can do.
Correct.
Right?
Yes, but there's still a standard. Standard. Yes.
But probably nobody care amalgam or gold crown or gold fillings, right?
No, that was not an issue.
Not an issue.
To be honest, since that my time in the military was from 2000 to 2005. I still was doing and advocating for posterior amalgams. Back then I don't think that there was the posterior composites were not as durable as they are now. So
you're right.
With the hygiene and different other aspects, amalgam at that time I felt very strongly was the best material for posterior restorations.
What did you learn to be in the Navy? What you think is totally different that you would never learn outside of it?
I think my very confident in doing and performing second molar endo surgical extractions. I was stationed in Great Lakes, and every recruit goes through Great Lakes, and everyone has to get their wisdom teeth taken out.
Real why?
Again, because dental readiness, you want to eliminate anything that could be a potential problem if a person was to be deployed. So,
Okay, sorry. Like I know because my kids, I know two of my girls, they all one already removed. I know why it was no kind of no pain, nothing, but they just said you have to remove.
yes,
But
and that's a misnomer that, so
I know,
you don't
yeah.
have to have pain, to have a potential dental problem.
Oh, yeah?
So there could, and it's from a preventative standpoint.
Ah,
So,
okay.
majority of the population, we don't have room in our jaws for third molars.
Third molar.
And even those that do, it's so hard to keep clean that,
Right.
then become an issue. So I, think that I've had maybe less than 5% of patients that I've treated that have room and are able to keep third molars clean. The majority, and if they're not causing a problem right then and there, they have a potential to cause a problem, and it's recommended to have them removed.
Probably, yeah, you're right. But in the ship, sailors usually do you need to do like anesthetic shot or they can perfectly fine?
Oh no, everybody got lidocaine.
Oh, yeah?
No, yeah, everyone.
Everyone.
Yeah,
Yeah,
everyone.
you don't have to. You don't have to keep a pain.
No.
I know they can. They can. I know they can.
On the ship, when we deployed for the 6.5 months, we had an oral surgeon, and we had an oral surgeon. He did TMJ surgery.
Really?
Yeah. So
Even the implants too? No.
No, we weren't doing any
no,
implants.
No implants. But if you need surgery oral, they can do it.
Absolutely.
Perfect. Can I ask you how was like 6 months out of land? How was the food? Because I know I just saw a documentary and I saw it's just unbelievable. It's like whatever you want. Is it true?
Okay,
Like,
well, I did have the privilege that I was an officer, so officers have their own mess, if you will.
Uh-huh.
So it was called the ward room where we ate. The chiefs had their own mess, and enlisted people had their own mess. So and there was different food, but keep in mind we paid for what we ate. I mean, we had to pay for it.
What do you mean?
So we were charged for the food.
Oh,
so it was a
really?
month on a monthly
It's not
basis.
included.
No, but we also, on top of our regular salary,
Uh-huh.
you're given a basic allotment for sustenance and a basic allotment for housing.
Uh-huh.
Those two things are separate from your salary, and you're not
I didn't know.
taxed on that.
Uh-huh.
So yes,
Uh-huh.
we did. The food was pretty good. When we were gone for 6 months, we didn't always have access to fresh produce. So every now and then we would get produce that was
From the
dropped.
ports,
Yes,
from the drop. Wow, interesting. But did you enjoy it to be like? I mean, you Navy, you like U.S. Navy. It's like what else you can? Do you proud of yourself to?
I am extremely proud. I had
Wow, it's just unbelievable.
Yes, yeah. I had an amazing experience. I would recommend that to anyone. I know that it's not for everyone,
Yeah.
but I would recommend any medical dental student to seriously consider that. To come out of dental school or medical school debt free.
With 300,000-400,000 loans.
Exactly.
When you're gonna pay all your life, probably.
Exactly.
Yeah.
And then just the training that you get. We finish medical and dental school, and you think you know everything, and you find out really quickly you know nothing.
Yeah.
And to just be in the setting, I was always in a setting where I had at least 3 other professionals that had a lot more experience than me that were there to help me. It allowed me to try procedures that I probably would not have tried because I knew that if I got into trouble, I always had someone to help me, to back me up. And the camaraderie is like none other.
Oh yeah, because I know my wife. She got a seasickness, and we went only once. It was my best vacation, and on that time it was the biggest cruise, the cruise liner. It's Allure, it's huge, and she still was.
So
How about yours, Timosh?
Yeah, well, prior to being assigned on the ship, I would always get seasick. I mean, to the point where I stopped accepting invitation on friends' boats because I would get really terrible motion sickness. But I definitely earned my sea legs, and I didn't have any issues. I mean, the first time underway, it wasn't full on motion sickness, but maybe just didn't feel completely myself.
But do you take any, I don't know, like a bracelets or some pills? No,
No,
it
I
just,
didn't need
it's
it.
gone.
It went away,
Wow.
and now I'm able to go on boats all the time.
Really?
with no problem.
Even smaller boats?
Yeah, even smaller boats.
Okay, I'm
yes.
gonna send my wife to the carrier. It's a good idea. It's a good. Okay, when you finish with Navy, how was easy for you to be in a real like civilian life? Is it
Yeah.
easy?
It was quite a transition, you know.
Exactly.
It's a big transition going from military life to civilian life. I did get a job right away as an associate
Mhm.
for a private practice in Chicago. And again, thankfully, I had a really good mentor there and learned a lot. And I worked for, like maybe 15 years as associate in
Mhm.
different offices, primarily 2 offices where I worked the most as an associate before purchasing my own practice here in Naperville about 5 years ago.
Wow. What's the difference to work just like work or to own your own business? I just want to ask you, how do you feel right now?
Well, it's challenging, but the reason I decided to purchase my
Yeah.
own practice was because I was to a point where I feel really confident in my clinical skill. It's a passion for me. I love doing the dentistry. And I thought, okay, like I could use a challenge of business ownership now. It's definitely harder. Like as with everything, it has its pros and cons.
Yeah.
You don't leave your workday and turn it off.
Yeah.
It's like
Yeah.
always something.
Oh, okay.
Dealing with the staffing, dealing with insurances, learning how much materials and supplies cost. It was funny, the auxiliaries I used to work with, I used to always tease them because they would give me so little of
Mhm.
everything, and
Yeah.
I would tease them and say, no one's gonna garnish your wages, give me more, give me another
Exactly,
piece
yeah.
of gauze.
But now you know.
But now,
Now you know.
now I know, now I have to
Exactly.
pay for it, so I'm like, okay,
Exactly.
like just a little drop.
It's only you, or you have another associate in your?
It's me only right now. I did have an associate for a time, but right now it's me. I also am proud and enjoy the fact that I do my own hygiene.
Wow.
I do. I love it. I really like to get to know my patients one-on-one. I feel that affords me that ability. My practice is small. It's a very boutique style. I love to learn about my
Mhm.
patients, get to know their family life. They know about my family life. My practice is called Twin Dental. It's called Twin Dental because I have identical twin
Oh, yeah?
sons. Yeah, they're 16, and
Oh,
so everybody knows about my sons. They're avid baseball players, and all my patients are always asking about their tournaments and stuff. It's really been a blessing.
It's like
And
a family.
yes, and owning my own practice, one of the major pros is having the autonomy to create my own schedule. So
Yeah.
I know
Right.
I hardly ever miss a baseball game.
Oh, yeah?
Yes.
It's your.
It's very
Okay.
nice.
Are they playing only baseball or any other sports too?
They play football as well.
Football too?
Yes.
At school?
Yeah, in school, in high school.
Very nice, very nice. And what mostly in your office? What mostly do you do removal, or it's a fillings, or now you do hygiene by yourself, but crowns? What mostly your kind of?
Yeah, it's a good mix of everything that I
everything,
do. So yeah, I have a lot of crown work. I get a fair amount of surgical extraction, third
Mhm.
molar extractions, again, because, I do have that experience, and a lot of people feel comfortable. As long as you don't want to be sedated, I don't do
Yeah.
sedation.
Even full
I'm able
sedation?
to-
Even full sedation, right? You do just the regular anesthesia.
Yeah, local anesthetic,
Local,
but not any conscious
Uh-huh.
sedation or
Mhm.
anything.
Yeah.
I like to do root canal therapy. I do perio.
It's been
Um,
full aspect of dental
Yes,
dentistry.
again, going back to what attracted to me in the first place is that it's never monotonous, so
I know.
it's always doing something different.
Yeah, probably because after your experience in the Navy, you can do probably anything.
I can do a lot, yes.
No, because it's never like you said, 7 days a week. Who can get this experience?
Yes.
Nobody. It's
No.
impossible.
Mhm.
And as you said, you learn so fast because you don't have a choice. You have to learn.
Right.
Yeah, otherwise, it's just gonna pull you over the board. Yeah. My dentist was so bad. Sorry, you're out. Any advice for our like new dentists? Now it's totally new era. As you know, you probably have scanner, right, in your lab.
I do.
Everything digital. Not
Yes.
everything. Mostly digital right now. Probably no more impression for crowns, right?
Great, no more impressions
That's
for
it.
crowns. Right, that's it. A couple of things that advice I would give that I feel strongly again would be to consider military to offset the costs of dental school, and the experience that you gain is like none other. Another thing that is of concern is the AI. So
Yeah.
you know, it worries me that if new young dentists are using AI to diagnose and what's available is that I think obviously it's a great adjunct, and the AI companies that are marketing this as, you know, a way to get more insurances to approve
Yeah.
different treatment. That's all fine and well, but if you don't learn diagnosis on your own and you start to rely on that, I think you're doing yourself and your profession a big disservice.
Because I heard, and now 100% it's true, I can't say where is it, but in the hospital they already use AI to diagnose. That means doctors already asking, what is it? And they rely on that and they still do diagnose, but it's already exists.
Right, yes. And not to sound like, you know, because nobody knows it all, but again, like how it's presented to me as to use this as a tool in order to get insurances to accept more claims, that's one thing, but I already been diagnosing for 26 years.
Yeah.
So it's a good adjunct, but someone that comes right out of school and they're relying on this, I think that's gonna make it difficult for them to really hone their diagnostic skills.
Except dentistry, except kids and family too, because it's our first hobby, I know. What other hobbies do you have you like to do like the most? Travel, or you have like maybe cooking, I don't know.
I actually love to cook.
Oh.
I do. I love to try new recipes, and you know, social media is really fun with that.
Nowadays, yeah.
Instagram and TikTok, I have my recipe folders, and I'm always saving things, and I actually do make a lot of those. I do love travel. I love to dance. I'm Latina, and so I love salsa dancing, bachata. I love to go to Zumba classes because you get in exercise and it doesn't feel like you're exercising, you're having fun dancing.
Where are you going to for dance classes?
Not dance classes, because I know how to dance already.
Oh, you just go to dance.
Yes, I mean, it's just from my culture. Growing up, we always had parties and everybody danced. So I always knew, I dance what they call street salsa. I'm not trained salsa dancer.
It's your style, I know.
Yes, so it's funny because there's been times where I go out dancing and then you're dancing with someone and they're counting.
Yeah,
and it's like,
1, 2,
you know, and they're
1,
like,
2,
which number
2,
are we
3,
on, you know? And I'm like, I don't know, I don't count. I use the beat of the music.
Because when we just came to the United States, I was working a bartender in Mexican dance club.
Okay.
And when I just came first, like after dinner, after midnight, it started dance. And they all chat bachata or salsa, and like close to like 4, 5, 6, everyone. The girl said, "Oh, Leo, I'll teach you how to dance." It was so much fun, but it was hard because they just dance like, but it was, and I still remember. Oh my God, yeah. And I know it's one restaurant. I know if it exists, it's called Alhambra Palace.
Oh yes, I've been there.
And they have a I forgot Friday or Saturday they have a dance too.
Yes, they do. And then like an hour before the dance starts, they give a lesson.
Yeah, exactly. We went a couple times there.
Yeah, that's a nice place.
Maybe we're gonna see it sometime. Okay, it was so nice. I mean, guys, it was unbelievable. Now everybody gonna go to military or Navy. And if you wanna have good teeth, if you're not scared about your wisdom teeth, beautiful office in Imperial where everybody gonna visit. Our Dr. Cynthia Cardenas. It was pleasure to meet with you. And for sure we're gonna see each other more and more and more. And maybe somewhere we're gonna dance bachata. I don't know. It's life, it's unpredictable.
Sure, absolutely.
Thank you so much.
Thank you.
Thank you. Thank you. Thank you for watching Chairside Stories. It means a lot to us. Please subscribe and follow us for more real conversation with real people.